Welcome to Hannity. There is nowhere else to run. The administration is finally being forced to answer tough questions about the disastrous ObamaCare rollout. Tonight, for the entire hour, we'll be joined by a very outspoken studio audience, and they are here to react to today's explosive testimony on Capitol Hill and much more.
Let the grilling begin.
I want to apologize to you that the website has not worked as well as it should.
The officials responsible for the disastrous ObamaCare rollout face the music on Capitol Hill.
You're saying the system right now is working?
I'm saying it's working. It's just not working at the speed that we want.
It was all one big lie.
If you like your plan and you like your doctor, you won't have to do a thing.
A new report proves the administration knew that millions of Americans would lose their insurance all along.
You keep your plan. You keep your doctor.
And our week-long series on the missed ObamaCare warning signs continues.
No matter how you look at this, health care costs are going to increase.
So what do people really know about ObamaCare?
You think affordable health care is more affordable than Obamacare?
No.
Ainsley Earhart hits the streets of New York to find out.
Which one do you support?
Obamacare.
Hannity starts right here, right now.
Now, tonight we know the administration knew for 3 years that if you liked your plan, you could not keep your plan. Now, they clearly lied to you, the American people, and obviously they didn't care. Remember, this was their promise.
Under the reform we're proposing, if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan. And if you do have health insurance, we'll help make sure that your insurance is more affordable and more secure. If you like your health care plan, you can keep your health care plan.
If you've got health insurance through your employer, you can keep your health insurance, keep your choice of doctor, keep your plan.
If you like your health care plan, you'll be able to keep your health care plan. Period.
Not true. Tonight, NBC News is in fact reporting that the Obama administration knew as early as July of 2010 that, quote, 50 to 75% of the 14 million consumers who buy their insurance individually can expect to receive a cancellation letter or the equivalent over the next year. So how are they going to spin this? We bring in our distinguished studio audience for reaction. Good to Lori.
Right.
Go ahead. Hi, Lori.
I was just going to point out that, thank you very much, to accommodate for Obamacare, basically companies are having to decrease hours, and so people are going to be earning less wages if they're not already. We're seeing an increase in temporary workers being added to the economy. So you've got higher taxes to cover this thing. These public health costs are through the roof. We're looking at an overall economic slowdown, which is worse than what we're seeing right now. It's very troubling.
Hadley, we haven't heard from you.
Right. Well, that's what the important point here with the 19 million people who buy their own health insurance. That's a growing pool. It's going to continue to grow as people lose their employer-based health insurance, as employers limit spousal coverage. They offered these benefits, and now because of the costs that continue to rise, they're not offering them anymore. So we act like the vast majority of people buy their insurance through their employer, which may have been true in the past. But we watch what's going to happen under Obamacare and these increasing costs for people who buy our own health insurance. I got a letter too, and I looked at my new premium. Under Obamacare, it's twice as much. So if you want to tell me that that's better for me, yes, I have.
How much is your increase in premium?
DC.
And did you successfully go through the exchange?
No, they gave me a price, but they couldn't enroll me. They couldn't enroll me because they gave me a they said call with your reference number, and they didn't give me a reference number.
The rough increase I've seen, I think, and I have to make all the comparisons, but I think it's $560 versus $650, all up. And then I'm going to be paying for all sorts of additional stuff like pediatric vision care and substance abuse care and all that. Now, it's a little bit like buying a car and somebody says, well, that Ford Focus you have, you don't really want that. You want to be in a Lincoln Town car with all the extra, lovely tires and the better suspension. And by the way, you can pay triple for it.
If I'm a young person,
and you have no choice in the matter, by the way.
Jennifer, if I'm a young person, I only want catastrophic care.
Right.
And that's cheap.
And by the way, a lot of people only wanted catastrophic care, and they took it away from people, especially small business owners, especially women who have few employees. They have taken away catastrophic care. If you're not under 30 and or have a financial hardship, you lose your health savings account and you lose your catastrophic care. Furthermore, for the young, if they don't pay their $95, what is the federal government going to do? They're going to take a gun to their head? They're going to try and lien property. The young don't own property. They have close to a 70% unemployment rate.
They're going to spy They're going to spy on you more.
Right. What are you going to do is what the liberals can't answer.
I got to take a break. We'll come back. And coming up, it is the eve of accountability. Health and Human Services Secretary Kathleen Death Panel Sebelius is set to testify tomorrow about the horrific healthcare.gov website. But will we get the answers that we deserve? That and much more from our studio audience right after this break.
Sean, our friends on the left like to talk about respecting women's right to choose. I respect a woman's right to choose whatever health care plan she wants, including the one she has right now.
All right, I agree with that. Go ahead.
When you say that I'm going to have better health care, first of all, you're confounding health care with health insurance. Health care is what I get from my doctor. Health insurance is a policy. It's a piece of paper, and I should be free to choose what's in that.
Lori?
Big issue is our entitlements are in bad shape, all of them across the board. You're putting a new one on the economy. We are broke as a country as it is. I don't know how any of these apply.
Well, you study business every day.
Yeah.
I mean, and how many people